Hello, it's me. I'm Dr. Kathryn Coe. I'm a neurosurgeon and multimedia artist in New York City. This is Art on Call, episode number 2, Medical Humours Redux. People think doctors don't have a sense of humor, in particular the neurosurgeons. And while it's hard to remain a brain surgeon in the presence of a comedian, what a relief it is after a busy week of trauma call and surgery to get a personal consultation from the healthy humorist, Dr. Brad Nieder. Hi, Dr. Nieder.
Hello. Well, thank you.
So, Dr. Nieder, you went from the emergency room to the comedy stage, and that seems like a logical move. You look like a healthy right-handed white male. What led you to comedy from medicine?
Well, I think with that question, you're implying that that most comics are not healthy or right-handed or white males, I guess. But I guess I don't fit that. The profile I always heard is that comics are depressed and have all these demons, and certainly that's been true throughout the years, but not so in my case. I think I was pretty well adjusted. I started writing some comedy in high school for the school newspaper, and then did improv comedy in college, and did stand-up while I was in med school. And I decided to make that my full-time thing and incorporate medicine and healthcare into the act. So I became a student of comedy as a kid. I liked watching George Carlin's HBO specials. I liked watching The Tonight Show. Surprised people that, hey, the quiet guy in the back is actually sitting there writing jokes and performing at the comedy club.
Singing's good for us too. Saying a little tidbit that I picked up. Singing is, as I was researching laughter, singing is good for us too. Quite literally now, when you wash your hands, what are you supposed to sing? Happy birthday. That's right, because then you know if you do the whole song, you've done a thorough job scrubbing and you've killed all the germs. I'm a germaphobe though, so I tend to sing the wreck of the Edmund Fitzgerald. Legend lives on from the Chippewa on down to the big lake, they all get you goomy. And CPR, what are you supposed to sing when you do CPR? Anybody know that one? Staying alive. That's right. Staying alive. No, that's true. American Heart Association recommends this. It's a true. This is true. Staying alive, because first of all, it's memorable, right, and it's an appropriate message. But more importantly, it's the exact beats per minute you should be doing CPR. And it took them a while to figure this out, because first they suggested Elton John's "Someone Saved My Life Tonight." Worst of all was Roberta Flack's lovely ballad "Killing Me Softly" with his song. Too slow and just wildly inappropriate, you know?
I loved it. And thanks for the tip on washing our hands.
Yeah, that's important for you. Scrubbing in, Kathryn, for surgery. You got to, yeah.
Well, I remember the song, The Wreck of the Edmund Fitzgerald, but aren't you a little young to know the lyrics to that song? Take us through the germination of a medical joke.
I think it starts with a nugget of truth, and if you just exaggerate it or change something, that's where the humor comes from a lot of the time. And it's just taking that bit of truth, that nugget of truth, and then exaggerating it, hamming it up, and write it all. And so most of the time I'm sort of writing notes down and trying to come up with material on my own.
Wow.
I read a lot, and I've got 3 little kids, so I get a lot of pediatric inspiration from them. And, again, a lot of it just comes from life, from truth. And my 2-year-old swallowed a dime the other day, and 2 days later it came out. Tails. So that's true. I mean,
what's the biggest similarity between medicine and comedy?
Oh, I don't know. They're so vastly different, and that, again, that's sort of what led me to hang up the clinical cleats and just do the comedy and the speaking full time. Is that I miss the creativity.
Last year, I got the call. They said, hey, can you come to Orlando? We'd love to have you. Your laughter is the best medicine program. We like how you combine the health and the humor. Can you come do that for us? I said, sure. How many people? I'm going to write prescriptions for I need a doctor now, folks. I got carpal tunnel syndrome or something, writing 2,000 of these things. Back in Denver, in this healthcare softball league I'm in, made it to the World Series game, and I dislocated my shoulder. Yeah, and it turns out, folks, Percocet is the best medicine. I got all the Percocet I want. I'm on it now. I mean, so I've had to revise my remarks for you a little bit, beginning with the title now. Instead of calling it laughter is the best medicine, I call it laughter is the best medicine unless you're in a lot of pain. Or you have a bad infection. Or you have giggle incontinence. So laughter is really the 5th or 6th best medicine. So,
Well, what specialty is the funniest, by the way?
Ah, wow, I don't know. You would think maybe pediatrics, because kids say the darndest things, but a lot of the pediatricians I've met are sort of, I don't know, they're kind of uptight.
But I can tell you which group is not funny.
Yeah, what's that?
The anesthesiologist. How do you keep on top of your game?
Well, you keep performing, and you keep...
Yeah, so you gotta sort of gauge what's too gross, what's too morbid. Maybe there's that gallows humor that exists in healthcare.
Okay, here's the question: what's the half-life of a medical comic?
Oh, I don't know. I'm finding out. I hope. I love what I'm doing, so I hope it's a while longer.
Some observations from our healthy humorist, Dr. Brad Nieder.
I travel quite a bit. That's stressful for me, going through. I was going through security recently, airport security, with a full surgical kit. Yeah, you can imagine this nightmare, right? I get, sir, we're going to have to ask you some questions. You can't get on board with those items. I say, oh, it's okay. I'm a doctor. These are the tools of my trade. I need these items. I need to take them on board. It's all right. No, sir, but some of those items could be used as weapons on board the flight. But it's a flight for life. It's the Medivac helicopter. Can we? Your friend can't get on either, sir, carrying that knife. Okay, he's the patient. I don't know. He's been stabbed. He's bleeding to death. Can we get on with this, please? They finally let us on, but I had to do the whole surgery on the chopper with only duct tape, a luggage key, and 3 ounces of peroxide. I mean,
My goodness. Well, I want to thank you, Dr. Nieder, for aerating our evening and for realigning our medical humors. I look forward to seeing you perform at the Neurosurgery Convention.